Hello, and welcome back to the Pelvic Empowerment Podcast. I'm your host, Dr. Liliana, and today I'm here to talk to you about the variety of reasons why you may see a pelvic floor physical therapist. I am coming to you after a day in the clinic, so I feel like this is so fresh on my mind. The clinic is where I see the most variety of presentations. When I am doing my private work, it tends to be very niche and very specific. I really love treating pelvic pain and especially pain with sex. And so when I'm doing my private work, it tends to revolve either directly in that area or like very adjacent to that area. But when I'm in the clinic, I see all types of presentations. And it occurred to me recently that there are a lot of ways that the pelvis presents, and we're often not taught what to look for in a healthy pelvis. And so when we're not sure what to look for, like when we're not sure what equals health, it can be really hard to determine what equals dysfunction. And furthermore, if we're not even aware of what constitutes dysfunction, then we can't be aware of who to go see or when to go see someone. And so it felt very important to me that we have an episode where we talk about this, because empowerment in the context of the pelvis, in a lot of ways, is connected to this theme. It's connected to knowing your body, knowing your unique baseline, like what is your typical, and knowing what care is available to you. So I figured it might be helpful to review the basic functions of the pelvis, what we look for in a healthy pelvis, and then some of the most common presentations that I see day to day and that are, it may not be normal, but are very common to see. So I want to try and stay really dialed in for this episode, because there are a couple different directions that I can already feel my brain zip zapping in. And I want to stay really honed into the different presentations, like the different diagnoses, the different symptoms that are really common. I want to do some other episodes to kind of at least one other episode on the function of the pelvis and the pelvic floor, because I think that's another really fundamental concept. But I don't want this episode to be too long. The intention here is to just share all of the, maybe not all, but as many as I can think of, the presentations that I see and work with, so that you can know, okay, if this is happening in my body, there is someone that I can go see. There is someone that can help me. There is treatment available for this. Because I have this conversation with my patients all the time where they come in and they're like, yeah, my doctor told me to come here, but I'm not really sure what you're going to do for me. I've had this problem for so long. And then I share everything that I'm going to do with them. And they're like, oh my God, I had no idea that this could even be helped. I had no idea that this type of help exists. And so that is the core of my intention for today's episode. And like I said, maybe we'll do another episode soon, for more context and for more nitty gritty. But I figure the best way to do this is to kind of go by system, and I'm going to do my best to just go off memory. I'm a very speak off the cuff type person. I'm just like, chilling on vibes here. I probably would benefit from making like a rough draft or something, but like I said, I'm coming from the clinic. It was like hot on my mind. I really wanted to talk about it. So we're just going to go for it. And if we need to make a part two, we'll make a part two. So, when I refer to pelvic health, there are a lot of systems that fall within the pelvis, within the pelvic area, the pelvic region. I do want to start off by saying pelvic health is for all people, like all genders, all ages. I specifically, at this point in my career, I typically only treat female anatomied bodies. So, an adult. So, adult female anatomied bodies. That is who I treat. I don't treat pediatrics and I don't treat male anatomy. I feel most comfortable and most specialized with the female anatomy. So that's why I choose to only work with it. But that's not to say that care doesn't exist for male bodies, and again for kids, that the care definitely does exist. And so if there is any dysfunction of any of the pelvic systems, please do seek out care. So then, what systems are related to or associated with the pelvis? First, we have the urinary system. So, your bladder, like your bladder's function, your ability to empty your bladder, your ability to like fill your bladder, bladder signaling. That it all constitutes urinary system. Then we have the digestive system. So your GI tract, specifically like GI tract and bowel emptying, that's mostly what we deal with. Um, your stomach, a little bit, not so much. Pelvic health definitely goes into nutrition or has the capacity to go into nutrition a little bit, but it depends on your provider. So, motility being how quickly things move through your GI tract, and then emptying, so evacuating your bowels. And then we have the reproductive system. So, female anatomy, I'm just going to stick with that. We have your uterus, your ovaries, your vaginal canal, your cervix. So anything having to do with your periods, menopause, pregnancy, birth and postpartum, that entire continuum falls within pelvic health. And if you are looking at the medical physician model, there's typically a specialty for each of those systems. So you would see a urologist to handle your bladder concerns. You would see a gastroenterologist to handle stomach and intestinal concerns. And you would see an obstetrician slash gynecologist, your OBGYN, for your reproductive concerns. Now, in the world of physical therapy, we our model, like the thing that we work with is function. And so the way that your bowel, bladder, reproductive system is impacted on a daily basis as it relates to the pelvic floor is what physical therapists work with, because your pelvic floor is a group of muscles that lives underneath all of those organs. It lines the inner rim of the bony pelvis, that thing, you can put your hands on your hips, that's your pelvis. The inside of that is lined with the attachment sites for the pelvic floor, which sits like a bowl or a hammock underneath your bowel, bladder, reproductive organs. Um, and so, the state of your pelvic floor, which is a group of muscles just like any other muscle group in the body, it should contract voluntarily, it should relax voluntarily. Um, the state of your pelvic floor can greatly influence all those other systems. So, pelvic floor physical therapy works with the pelvic floor in order to support all of those other systems. So, what are some examples of dysfunction that would lead you to see a pelvic floor physical therapist? I'm so glad you asked. Let's get into it. So, let's go one organ system at a time. So, we'll start with the bladder. Most common is urinary leakage. So, if you are experiencing drops of leakage, I had one patient ask me actually one time. She was like, "Well, what counts as leakage?" We had been talking about leakage the entire time. So when she asked me that, kind of halfway through the session, I was like, "Oh, interesting." I just turned around and said, "Anytime pee comes out that and you are not on the toilet, that is leakage." So anytime that you did not willfully empty your bladder and it just came out, that is leakage. Anytime, any amount, that is leakage. And the more we talked about it, I came to understand that she was not defining it as leakage because it was such a small little amount. And as many of my patients say, she said, but that's normal. Everybody leaks a little bit, right? Like when they laugh or when they sneeze, everybody leaks. So it's not really leakage. And I was like, ah, girl, yes, it is. Just because it happens to everybody doesn't mean it's not leakage. And furthermore, we should not be accepting that it happens to everybody. And I tell this to everybody. I'm like, tell your friends, talk about this at dinner. Tell your friends that this is not the norm. We do not have to be okay with this. And I think there is a big cultural shift that's happening. Because for a very long time, it was just the accepted cultural norm. This is something else that we could go into. I can feel myself already. How many minutes in are we? And I have only touched on one diagnosis. There's so many directions we can take this conversation. Anyway, so urinary leakage in any capacity. So whether that's with coughing, laughing, sneezing, lifting, running, jumping, anything that puts exertion, like exertionary stress on the body, and causes urine to escape, that counts as leakage. We call that stress leakage or stress incontinence. Again, because it has to do with that exertion and that stress moment on the body. The other type of leakage is urge leakage. So that would be like if you have the urge all of a sudden and then you're just leaking. Like they're very closely associated. You have like less than a minute to get to the bathroom. Also very common. And that is the first one is more of a strength issue. The second is more of a signaling dysfunction, like a brain to bladder dysfunction. So leakage, that's a big one. Incomplete bladder emptying is also a really, really common one. And I see that a lot. It can lead to a lot of abdominal pain. So anytime that you leave the bathroom and feeling, or like you pee and you feel unsatisfied, like you feel like you have not completely emptied your bladder, that counts. Whether it's frequent or infrequent, there are ways that we can work with that. So it's not something that's just like, oh yeah, my bladder just doesn't just doesn't empty. That's not something you have to accept. Another one's frequency. I hear this all the time because I hear people say, yeah, I go often. Like in my exam, I'll say, well, how many times a day do you pee? And a lot of times the response I get is like, oh, I don't know. And then I go, think about it. And I make people sit and really think, because you should not be going more than 6 to 8 times in a day. You should not be going every hour. It takes at least 2 to 5 hours for the bladder to fill. So any more than that is a signal that something is off. And it's actually much less common that you actually have a small bladder. I hear that all the time. People are like, well, I've always had a small bladder. I have a small bladder. And what that often means is that that person has built a strong habit since they were very young, and now their bladder signaling is very strong, and it feels like they have a small bladder. Some people truly do have a small bladder, but the only way that you can know that for sure is with urodynamic testing, and that's where they fill your bladder and they scan to see how much went in and how much came out. So that would be the only way to know for sure. So if you are peeing every single hour, know that that is not okay, and that there is help, something that you can do about it. So let's move on to bowel. So dysfunction of the bowel. Anything that leads you to not be pooping on a regular basis. The normal range is that you are pooping either 3 times a day or every 3 days. That is the range of normal, which I definitely believe. And I've had some people that really truly do poop once every 3 days, and it feels very healthy and very normal for them. Now, I personally, my personal bias, anecdotally, what I've seen in really healthy people, once every 3 days to me is a little bit too long. I like to see people pooping every day, roughly around the same time of day. I can acknowledge this is a bias, but it is the bias I work with, and will often encourage in my patients. And maybe it's worth me looking through the research again. Again, I'll acknowledge that too. But that is typically what I strive for in myself and what I do encourage in people. So if you are somewhere outside of that spectrum, that you are emptying your bowels more than 3 times a day, or that you are going more than 3 days in between your bowel movements, that's an issue, and we can help with that. Other things, constipation, diarrhea, hemorrhoids, things like that are also things within our scope that we can treat. Oftentimes, it's a lot of management strategies. So, looking at your nutrition, looking at your eating schedule, even looking at your sleep schedule, trying to do the best that we can to optimize so that your motility is consistent. That's how fast your stool and food digests and moves through your GI tract. Um, but yeah, to promote motility and to promote evacuation. And the pelvic floor plays a big part in that. For bladder and bowel, your pelvic floor plays a very important role in the management of both of those daily tasks. These are daily functions that the body has to complete, and the pelvic floor can play a really important role in both of those things. Maybe that can be another episode too. I'm happy to go into like the nitty gritty anatomy side of what the pelvic floor is actually doing. But I think that's too much for today. So I want to keep going. And when it comes to bowels, even if you have diagnoses like IBS, diverticulitis, things like that, pelvic floor PT can be very helpful. With those chronic types of diagnoses, we can't really reverse them. Like pelvic floor PT isn't going to be enough to like cure your IBS, but there's a lot that we can do to help manage and help support. And in a lot of cases, inflammation is a really big key player. And so we do a lot of education, a lot of management strategies to help optimize and promote function of the entire system. So pelvic PT really is like, if you can relate it to function, chances are we can help. Okay, so the next system, reproductive system, this has a couple different facets. So let's start with your cycle first. Um, this is one of my favorites to work with as well. So when it comes to pelvic pain, I think before I just said pain with sex is my favorite, but I think pelvic pain in general, there's a lot of nuance to pelvic pain. Pelvic pain with sex, I think, is one of my favorites to work with because it's something that I experienced really intensely, and so it was really rewarding for me to heal in myself, and so it's always extra rewarding when I see it in others. But pelvic pain in all of its forms, I think is really important to work with, and especially because I think so many people have dealt with either, endometriosis, fibroids, PCOS, PMDD, like all of these diagnoses related to the reproductive system that are often just shrugged off or dismissed or met with just the classic, like, well, we really don't know. And it can be really challenging to navigate as a patient. So, pelvic PT is one of the resources that is available to you, and has been shown to, again, not necessarily cure, but to really make a difference in your day to day sensation and experience. So, um, yeah, when it comes to your cycle and your period, I really recommend pelvic floor PT kind of like at baseline for anyone that's having any type of cyclical issue, whether it's pain, PMS, irregularity, like if your cycle's really irregular or if you're skipping cycles. Often the medical management approach will just put you on birth control. And I think there is so much more that we can do before putting someone on birth control. Here we go, another huge conversation that would love to make an episode about at some point. But I think birth control is often advertised as a hormone regulator, like, oh, your hormones are out of whack, so we're going to put you on birth control so that we can regulate everything. And the truth of it is that it's not regulating your hormones as much as it's just stopping your hormones and slash or like really controlling your hormones. So it's not doing your body any favors, um except in certain circumstances, I will say. Because I want this to be about empowerment. I want you to have access to both sides of the conversation, because birth control is not bad. A lot of people need birth control. And especially when pain is incredibly difficult to manage and when cycles are very difficult to manage, birth control in those situations, I think, is very much so indicated. This has been a polarizing opinion in some groups that I've been in. I've received some backlash for this opinion, but it's my opinion. And I'm always open to having a discourse and a conversation. So if you have differing opinions, please respectfully, kindly, but leave it in the chat, comment about it. Let's have a broader discussion here, because the root of my issue that I take with birth control is that I think it is too often prescribed unnecessarily. And I've heard of people that come to see me and they say, "Oh, well, I've just been on birth control since I was 13. They put me on it for acne and it's worked for me, so I haven't come off it." And in those situations, the body never has an opportunity to truly practice and refine the hormone cycle. Our body cycles every month, and we only get an opportunity to go through that cycle once a month. So it's funny because I know often we get our periods and it's like, oh my gosh, this happens all the time. I'm always on my period. This is so annoying. Why does this have to happen every single freaking month? But when you think about it in terms of like hormonal changes and hormonal regulation, the amount of hormone changes that happens in just one cycle is actually really profound and fascinating. And the fact that it only happens every month, to me, it almost feels like it's not enough opportunities for our body to practice, because our body our body is rhythmic, our body is cyclical. It does need time to adjust to your circumstance, to your stress, to your environment, all of these things. And so if it doesn't have that opportunity to refine, um the system is not going to be okay. It's not going to be optimized. And I think we're seeing a huge issue where we've had people on birth control for many, 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 many years. They come off, try to get pregnant, and then struggle to get pregnant. And I'm not drawing a very like super direct conclusion here, but I do think it's something that's worth looking at. I don't know what the research is, if there is even research between the impact of birth control on reproductive health specifically. I've heard some things, but I haven't looked at the research myself to kind of audit it myself. But I just think we need to be intentional. You can't shut off a system for 10 years and then turn it back on and expect it to work perfectly the first time. It's just not fair. It's not reasonable. And I did attend a conference one time that a speaker, it was a PT conference, and I don't remember if she was a physician or a PT. I don't remember what her background was, but she was talking about this exact concept. And she said that, again, I'm not sure what the research is here, but she said that based on what she found, the hormonal cycle can take up to 12 years to fully mature. So that's from the time of your first period. And I think that makes perfect sense. Like, if we're supposed to get our periods between 9 and 12, let's say on the late age, and or the late side, we take 12 years to mature, that puts us at 24 peak reproductive age. So that makes sense to me. And it takes, that it takes all that time to mature, to be optimized, to work really well. And then at that point, we can easily become pregnant, have a smooth pregnancy, have a good labor and delivery. So that makes sense to me. All of this to say, I knew I was going to go on tangents with this episode. But thanks for bearing with me. All of this to say that any type of cycle irregularity, I recommend pelvic PT as kind of like a first line of defense. Not birth control, definitely before birth control. If PT doesn't work and things continue to not be functioning appropriately, then I think birth control is a great option. And again, it's about empowerment. What feels best for you? The person that called me out on this opinion one time, I was at a PT education, like a continuing ed thing, and I shared this opinion, and she was like, she heavily disagreed. And we had a nice conversation, and I that's kind of how it ended, where I said, like, hey, like, I don't think it's wrong. It's not a hill that I die on. None of my opinions are hills that I die on, especially in the context of medical decision making, because it needs to be what feels best for you. If you're on birth control and your only reason for being on birth control is convenience, that's great. That's your empowered decision. There is no right or wrong. So I really want to highlight that it's not about what's better and worse. It's just about looking at all angles. And those are the angles I would like you to be aware of, and take away from this conversation. So thank you for listening to all that. So moving on, though, things that pelvic floor physical therapy can be helpful for. So we have irregular periods, pain. So pain with your periods, but also pain, abdominal pain or pelvic pain in general. Like if you're having day-to-day pain, not associated with your cycle, or not associated with any specific stimulus, that can be indicative of pelvic floor dysfunction. That's a great reason to come in. Pain with sex is another really common one. This is another one socially that I think some of us have just come to accept, that there is going to be a little bit of pain, and that's okay. You just got to push through. The classic, oh my god, the classic old school, well, have a glass of wine. Oh, so terrible, so terrible. If you are having any amount of pain with sex, seek help. I will also add, if you are having sex and let's say it's not painful, but it's also not pleasurable, seek help. Sex is supposed to be pleasurable, fun, exciting. It should only be painful if you like it painful, but it should not be painful um, in a way that's uncomfortable, intolerable, and takes away from your enjoyment of the experience. If you are not experiencing pleasure and if you are not experiencing orgasm, these are all great reasons to go see a pelvic floor physical therapist. Orgasm, especially, orgasm is rhythmic contraction of the pelvic floor. So if you're not orgasming, definitely reason to see a pelvic PT. Um, Additionally, when it comes to the reproductive system, pregnancy and postpartum, that's a huge one. So let's say you do have a great cycle, you do have great sex, and then you do get pregnant. Ideally, I mean, there is no like set standard in the medical community of like what you should be doing, but I really do think it's great to go see a pelvic floor physical therapist either early on in your pregnancy, or somewhere in the middle, somewhere towards the end. Obviously, if you're having issues, go see a PT during pregnancy. That's who you want to be seeing if you're pregnant. I know at my clinic there's a lot of times where even if, like, no matter what the experience is, like, even if it's like just basic hip pain, if you're pregnant, they'll send you to a pelvic PT because we're trained to, we're the ones that specialize in the pregnant presentation. So we know what things are indicated, contraindicated, different ways that we want you breathing, or, posture and mechanics, things like that. It's our specialty. So go see a pelvic PT once, if nothing else, at least once, to assess the state of your pelvis prior to giving birth, and then of course after birth. Also, a pelvic PT is a great resource for birth prep. If you're not sure what to expect, if you want to learn different pain management strategies, different positions, this could be another great episode of just ways that your pelvic floor influences the labor and delivery process, because your pelvic floor needs to relax in order to have an easy and smooth birth. You could be doing everything right, but if your pelvic floor is really tight when you go to labor and deliver, it's going to be a different experience. So, pelvic PT before birth, birth prep, and then after birth, we definitely are available to support you in the postpartum journey. A lot of the things that I mentioned before, of like urinary leakage or changes in bowel function, like constipation, diarrhea, hemorrhoids for sure, can all pop up in postpartum, even if you've never experienced them before. And that's not to mention, abdominal weakness, especially if you have that diastasis, that ab separation in the front, pelvic floor weakness, pain in the back, pain in the hips. All of it's related, and all of it is helped by pelvic PT. So definitely something that is available to you. Moving on in the reproductive system, we have menopause. So when the hormonal system shifts out of that monthly cycling, we see a huge shift in the body. Your tissues change with menopause. Estrogen is such a protective and helpful hormone to have. And once that hormone drops, things change pretty significantly. And again, culturally, we tend to not provide a ton of care to our menopausal population. And I think a lot of women that I see that are menopausal, perimenopause, menopause, postmenopause, anywhere along that continuum, they are also quite shocked and didn't realize that there was so much care available to them. So, yes, again, know that there is support, whether it's for you or someone that is experiencing any of these symptoms. There is support. Oh, and the last diagnoses I wanted to touch on that kind of can happen in any of the symptoms or systems is prolapse. And so prolapse is what happens when the walls of the vaginal canal thin a little bit. So they don't have as much structural integrity, and when you have poor pressure management. So pressure management is a huge theme when it comes to rehab at the pelvic floor, because your pelvic floor is part of your core, and your core is your center of stability. And your core is it's 3D, right? So you have your abs in the front, your back muscles in the back, your diaphragm on top, and your pelvic floor underneath, and it makes this canister. And if pressure is well managed, we have a nice stable center. When pressure is poorly managed, that means that we are kind of pushing and exerting in places that we shouldn't be. This is how you can end up with hernias and slash or prolapse. So again, prolapse is when the walls of the vaginal canal lose a little bit of integrity and we are not managing pressure well, which means pressure bears down onto those organs and onto the pelvic floor. And what can start to happen is that those organs can start to kind of come down through the vaginal canal. They never like perforate, like they never come through, but they start to press into. And that can over time result in tissues dropping inside, like into the vaginal canal, or even outside of the body in some cases. And that's an issue. That is a symptom presentation that we treat. And so if you have heard of that, that's one that I whenever I tell some of my peers, like my younger friends, I get a lot of like, oh my God, I didn't even know that could happen. And I want to share about it because it's one of those things that it's like, yep, it can happen, and not to spark fear, but just to spark an awareness of the body. And again, knowing that there is help for these sorts of things. So prolapse is one of those. Now, there are some other diagnoses that come to mind. more like specific presentations. And there's just a couple that are kind of popping into my head right now. One of them specifically, interstitial cystitis. So this is a presentation of the bladder when the bladder forms lesions, and it can cause a lot of different painful types symptoms, difficulty emptying, frequency, like increased frequency. There's also lichen sclerosis. That's something that you can see externally at the vulva. So it can be white and be kind of like patchy in its presentation. It can cause tissue changes and can also cause significant pain and changes to some of your pelvic presentation. I did go over some of the pain ones, pelvic pain like endometriosis, adenomyosis. I did say a couple there. That's about it as far as what's popping into my head right this second. Like I said, if anything else comes to mind or I see anything on my caseload that I didn't mention, I will be sure to make a part two. The other thing to consider is that other body presentations can all impact the presentation of the pelvic floor. So, two that come to mind right away: fibromyalgia. Is something that can absolutely impact your presentation on a global level. Hypermobility is another one. So things like EDS, and then some of it's like co-presenting things like POTS, um, postural orthostatic tachycardic syndrome, something like that. POTS, that's the one where if you get up too quick or if you change position too fast, you can get really dizzy. Very common in the hypermobile population. And I would encourage you to seek diagnoses. I think especially as different diagnoses are becoming more prevalent, there's a lot of self-diagnosing going on. So I have a lot of people that come to me saying like, "Oh, I think I have POTS or I think I have EDS, but have never been diagnosed." And if it would be helpful for you to know these things, I think you should pursue getting diagnosed. And I tend to document that and encourage people to say, like, instead of "I have EDS," if it's undiagnosed, say "I have hypermobile tendencies," because the diagnostic criteria is there for a reason and is very specific. So I always encourage getting a diagnosis if it feels appropriate, but also yeah, just being super super clear with our language and with our intentionality when we do talk about the body and our presentation. So, thank you for sticking around for the multitude of directions that this conversation took us in. If there is a bottom line, which there is, the bottom line, the bottom line to all of this, as always, is empowerment. I want you to start taking inventory of what your body feels like on a day-to-day basis. Maybe this could be a great journal prompt. Taking note of how each of these systems presents for you on the day-to-day. What have you come to accept as your normal? What do you define as normal and healthy? And seeing if there is or isn't any dysfunction in any of those presentations. Having a very clear understanding of your body's baseline and the way that your body presents is the root of empowerment, because it is only when you have a really clear understanding of who you are and how your unique body presents that you can start to envision, well, what do I want for my body? You cannot have a vision if you don't have a clear baseline. And even if you don't have any dysfunction, the vision is to stay healthy, to get healthier. There is never going to be a perfect presentation. And so, for all of us, myself included, it's important that we come back to this as our foundation, as our home base. This knowing, this self-awareness of how does my body operate? What does my body need? In what ways am I settling and in what ways am I striving for more? And how can I get the thing that I want? This is how I define empowerment. Essentially saying, I know what I want, I'm clear, I know what I am, I know what I want, and I know how to get there. I feel empowered, I feel confident, I'm moving with this light and this power, and nothing's gonna stop me. Nothing's gonna stop me because I'm empowered. That's it. Ding ding ding. Confetti cannons go off. um so that is my encouragement to you. That is the pelvic empowerment theme that I'm bringing to you today. Um, really recognizing, where are things working, where are they not, what can I do about it? And in this context, what can pelvic floor PT or holistic pelvic wellness do for me? How can I go deeper? I feel like in listing out all of these diagnoses and all of these presentations, my immediate next thing that I want to share is like all of the anatomy and all of the science behind it, and just, being able to break down like, why does this system work the way it does, and how do we get from point A to point B, which hopefully we will do in some future episodes. But don't forget all of the impact that even just some mindfulness, some awareness, some self-love, some safety and grounding exercises can do for you and for your pelvic symptoms. Your pelvis is so deeply connected to your nervous system. So if you are experiencing significant ongoing stress, or that you're constantly in your fight or flight response, your bladder, bowel, and reproductive system will be impacted. So yes, we're going to talk about the science of how to heal, but we also need to be really tuned in to the spiritual, emotional, energetic side of healing as well. Both are important, both go hand in hand, and when you do work both at the same time, the results are incredible. So I really, really encourage you in that. And I'm excited to hear your thoughts. I want to be starting and having conversations. So if any of this pertains to you, if you have more questions, if you'd like to book a one-on-one, maybe virtual call to discuss your symptoms or discuss your presentation, I'm here for that. I would love that. That's a great way to kickstart your journey, whether that leads to deciding to work with a PT in your area, or if you live near me and we can work together, whatever it is. I like that idea. So I'll have all my information in the descriptions below. As always, please feel free to reach out, and I'm really thankful that you're here and listening and are interested in this field. And I will be back soon with more to share. But for now, thank you. Thank you for listening. I really hope this was helpful and that it was inspiring for you, and maybe even eye opening to what this field is about and what your body can do, because it can and should live without pelvic dysfunction. So I'll leave you with that. I will see you in the next episode. Thank you again. Wishing you nothing but the best. We'll talk soon.